This video will show you how to talk about diabetes using Feltman. It's designed for Aboriginal health workers and other health professionals. Feltman can be used to explain what happens to glucose in the body of a person who has diabetes, diabetes management including preventing complications, and how to reduce the risk of type 2 diabetes. Diabetes is a condition where there is too much glucose or sugar in the blood. There are three main types of diabetes. Type 1 diabetes happens when there is no insulin made by the pancreas. Type 2 diabetes happens when not enough insulin is made by the pancreas and when the insulin is not working properly. Gestational diabetes is a temporary form of diabetes that some women have during pregnancy. It usually goes away when the baby is born. In this video, we'll talk about type 1 and type 2 diabetes. For more information on gestational diabetes, refer to the Feltmum video. First, let's use Feltman to identify the organs of the body, the brain, the esophagus or food tube going down into the stomach, the intestines, the heart, the liver, the pancreas, and the 2 kidneys. The red lines represent blood vessels and the white lines represent nerves. We're showing a muscle here as an example of what happens with muscles throughout the body. Now, let's use Feltman to show how carbohydrate food is digested and used in the body. When we eat carbohydrate food, like bread in a sandwich, it goes into the stomach and intestine where it is broken down into glucose. You can use the glucose discs to show this. The glucose is absorbed into the bloodstream from the intestine. In the bloodstream, the glucose travels to all parts of the body, including the brain and muscles, to give us energy. The brain needs a constant supply of glucose to function properly. Glucose can flow straight into the brain. It's important to remember that glucose can't get into the muscles without help. Muscles have receptors on them that are like locks that need to be opened to let glucose in. The body uses insulin like a key to allow glucose from the bloodstream to enter the muscle cells. The pancreas produces some insulin 24 hours a day. After eating carbohydrates, the blood glucose level rises. The pancreas senses this and releases more insulin into the bloodstream. Use the insulin keys to show how insulin travels along the bloodstream to the muscle. Insulin acts like a key, undoing the lock on the muscle to help glucose enter the muscle for energy. This lowers the blood glucose level. In a person without diabetes, the blood glucose level goes up and down but always stays within the normal range, between 4 and 8 millimoles per litre. After a meal containing carbohydrate, the blood glucose level is closer to the top of the normal range. A few hours after a meal, when the insulin has helped to move the glucose into the muscles, the blood glucose level will be closer to the lower end of the range. Now let's look at what happens to glucose in the body of a person with type 1 diabetes. In type 1 diabetes, carbohydrate food is eaten and broken down into glucose, just the same as in a person without diabetes. Glucose is absorbed into the bloodstream and travels around the body in the same way too. In type 1 diabetes, no insulin is produced, so no glucose can get into the muscles for energy. This leads to a buildup of glucose in the blood. The body then looks for another source of energy, so it breaks down body fat. When fat is broken down, ketones are released into the bloodstream. Without insulin, toxic levels of ketones build up and a person with type 1 diabetes can get very sick very quickly. People with type 1 diabetes need insulin through injections or a pump to live. Insulin is needed to lower blood glucose and prevent ketones building up. Now let's look at what happens to glucose in the body of a person with type 2 diabetes. In type 2 diabetes, the carbohydrate food is eaten and broken down into glucose just the same as in a person without diabetes. The glucose is absorbed into the bloodstream and travels around the body in the same way too. In type 2 diabetes, the muscle cell receptors are not working properly. It's like the locks are rusty. This is called insulin resistance. When insulin is released from the pancreas and travels to the muscles, the insulin cannot open the locks properly. This means that only some glucose can get into the muscle, but not enough. This leads to a buildup of glucose in the blood and means that more insulin is needed. While people with type 2 diabetes do make some insulin, it isn't enough to keep blood glucose levels in the normal range. Over time, the pancreas can get overworked and make less and less insulin. A person can manage this through healthy eating, exercise, and diabetes medications. You can use the Feltman cards to talk about the symptoms of diabetes. The body tries to reduce the glucose in the blood by flushing the excess glucose out in the urine with extra fluid. The body is left dehydrated and a person feels thirsty. The muscles start to feel tired and weak because they are not getting the glucose they need for energy. These symptoms are sometimes known as the 3 T's: toilet, thirst, and tiredness. The excess glucose can cause the lens at the front of the eye to change shape and go out of focus, causing blurred vision. Vision usually returns to normal when the blood glucose level comes back down. The high glucose level stops the immune system from working properly, which can result in infections and sores that don't heal properly. A person would not usually feel the symptoms of diabetes until the blood glucose level is over 15 millimoles per litre. Therefore, people with type 2 diabetes may not have any symptoms and may not know that they have diabetes. It's important to encourage regular health checks. Feltman can be used to talk about the complications of diabetes. Complications can happen if blood glucose levels remain high for a long time. Blood carries glucose around the body, and too much glucose can cause damage. This includes kidney damage, nerve damage, such as a loss of sensation in the feet, poor circulation, which may lead to limb amputation, heart attack and stroke, teeth and gum problems, sexual problems such as impotence, and eye problems such as vision loss or blindness. Keeping blood glucose levels in the target range can help prevent these problems. Feltman has prompt cards, a healthy retina disc, and a disc showing diabetic retinopathy that can be used to talk about eye health and diabetes. The most common diabetes-related eye condition is diabetic retinopathy. There are no symptoms in the early stages of diabetic retinopathy. Damage at the back of the eyes can happen before a person notices changes in their vision. Anyone with diabetes can develop diabetes-related vision loss or blindness. This can usually be prevented by early detection and treatment. More information on eye health and diabetes can be found in your Feltman kit. You can use the Feltman cards to provide advice on diabetes management. People can manage their diabetes by regularly checking blood glucose levels, taking medication as prescribed, seeing their doctor regularly for diabetes health checks. These include blood and urine tests to assess blood fats and kidney function, having blood pressure checked at every clinic visit, and having HbA1c checked every 3 to 6 months. A diabetes educator, Aboriginal health worker, or GP can help people manage their diabetes. People with diabetes should also visit the following health professionals at least once a year: an optometrist for an eye assessment, a podiatrist for a foot assessment, a dentist to check teeth and gums, a dietitian to discuss the right amount and type of carbohydrate food with each meal, and an exercise physiologist for an exercise plan. A GP can provide a diabetes care plan, which usually includes other health professionals. The GP can also refer to a diabetes specialist called an endocrinologist. It's important for everyone with diabetes to have a healthy lifestyle. This includes eating healthy foods, keeping to a healthy body weight, and being physically active. Living with diabetes can be stressful. Talking with family and friends and other people living with diabetes can help. There might be a diabetes peer support group in the local area. If a person with diabetes is worried about their social and emotional well-being, there is help available through a referral to a counsellor or psychologist. The costs may be partly covered by Medicare if referred by a GP. Feltman can be used to talk about the risk factors for developing type 2 diabetes. You can do this by using the risk factor cards in your kit. As mentioned earlier, type 1 diabetes is a condition that cannot be prevented. The risk factors for type 2 diabetes and gestational diabetes are similar. Some of these factors include being inactive, having excess body weight, smoking cigarettes, having high levels of fats in the blood, having a large waist, having high blood pressure, having a family history of diabetes, and increasing age. Having a history of heart attack, pre-diabetes, gestational diabetes, or polycystic ovary syndrome are also risk factors. Taking certain medications, such as steroids and some mental health medications, can also increase the risk of type 2 diabetes. It is important that the person keeps taking these medications and speaks to their doctor. Type 2 diabetes is 3 times more common among Aboriginal and Torres Strait Islander people and some other cultural groups. Addressing the factors that can be changed can help to prevent or delay type 2 diabetes. There are prevention cards in your Feltman kit that can be used to talk about preventing type 2 diabetes. That's the end of the Feltman training video. We hope you found it useful. You can also refer to your Feltman kit to find out more about diabetes and how to use Feltman. For any other inquiries about Feltman, contact Diabetes Victoria on 1300 437 386.